SAfm 104 to 107 nationwide. Leading the conversation. Mediated conversation on SAfm.
011-714-2006. Please do call in and join the conversation as we speak. Substance abuse during festive season. You can also WhatsApp 0614104107. SMSs go to 41391. Let's welcome our first guest, who is Dr. Malebo Mashaba, who is from Rifile Health Group. Thank you very much, Dr. Mashaba, for joining us.
Yeah, thank you so much. Thank you so much.
Substance abuse is something that we are grappling with in the country, but during the festive season, it becomes very prevalent. Why is that?
I must say, just giving a background, that substance abuse in South Africa is a severe and disturbing problem, and because it brings with it a series of multifaceted challenges that have continued to weaken our social fabric in our societies. So when we go through into times like this, the festive season, remember that's when also we've got increased levels of crime as well, and a lot of movement that is happening during the shopping. So most of the substance abusers are also targeting those that will be going out more and doing a lot of shopping to try and get some form of monetary benefits, to try and treat their habits. Because it becomes more like when the normal society, so to say, would be saying this is what they want to get or do for themselves to please themselves during this festive time. So it's also a plan for them to try and get something more to try and feed their habit, which is more of amplifying their day-to-day activities that they normally do throughout the year. So now we are more likely to see increased criminal activities from the substance abusers that are out there on the streets.
But let's be honest, it's not only the substance abusers who are on the street that we should be worried about. It's also those who just don't know when to stop when it comes to festivities. So just because I'm on holiday, no longer going to work, I've got a bit of a bonus, I now start abusing things like alcohol. For those who have cigarettes, they're smoking consistently. And we worry about such people who are close and dear to us, who are sometimes professionals. So how can we then help them, Doctor?
At this time, I think it's most of us, psychologically, we tend to ascribe to this time being the time where we relax, we can get to do what we want to do, and we become even reckless with how we spend our money, and it's more of we want to overindulge. So as a result, it's very important. I think we've been spreading the same message throughout when we went from October through the mental awareness, is to say that it is very important that any form of a routine or any form of an activity that you've been embarking on, the moment you are able to pick up that it is no longer functional for you, it is now starting to become an addiction, something that you cannot stay away from. It's very important that you seek help from those that are close to you, that you can rely and depend on them, that those that you trust, to try and help and have the help that is needed at that time. But unfortunately, with the kind of a society that we find ourselves in, such first-hand help, it's more in the scarcity level. So as a result, that is why even with all the implementations and programs that are put in place by our government to try and deal with the surge of substance abuse, constantly we have an increasing number of substance abusers in South Africa.
Why are we such a substance-dependent society? Has psychology given us an understanding to this?
Yes, because there are so many psychosocial factors that are predisposing a lot of our people to mental health related issues that are also linked to substance abuse, like our gender-based violence, the divorce, the domestic violence that is happening in our societies, financial distress, as families try to provide care and emotional distress, such as stigma and shame as well as disparity in terms of one not being able to achieve what they want to achieve. Levels of unemployment have been some of the elements that have been predisposing our people to increased use of substances in different categories.
So clearly we need something to revive and revitalize our socio-economic situation as a nation so that we can curb substance abuse.
Yes, because remember, as human beings, it's in our nature that we want to self-actualize. So as a result, if there is a need for you to achieve something, there's a need for you to meet a certain level of standard of living, and there are hindrances. We opt to adopt any kind of method to try and achieve that. That is why we've got increase in crime. That is why we've got people who instead run away from their problems, get exposed to addiction. Because when we talk of addiction, it's not primarily only substances. It's alcohol. It's different eating habits. We've got people who are binging. It's an addiction. It's a way of running away from whatever it is that they cannot cope with. So I think when it comes to resolving such psychosocial issues, there are steps that are being put in place, and we are getting there, even if we are not yet there. But we still have a lot to do in South Africa to try and address all the differences in the economic sector as well as psychosocial sectors that needs to be addressed. Because remember, you can have a person who's been sent to a rehabilitation facility for substance abuse, but if you don't deal with the underlying psychosocial factors, the person will go for rehabilitation and still come back and relapse. And I think that's where we are as a country, that you've got an upsurge of relapse cases in South Africa. And as a result, they tend to paint the picture of recovery as more or less, because we are having a repeated cycle of clients that are coming into rehab facilities year in, year out. And these are similar cases, similar clients. So as a result, we still have a lot to do, not only focusing on rehabilitation, but also including the society, including families, including NGOs, to try and have a comprehensive way of addressing substance abuse, to try and work on the statistics. And also remember, it's not only about the number, but also the mental health of all of the substance abusers, because it affects their mental health. And once your mental
Thank
health
you
is
so very
affected,
much,
the society
Dr.
can never be
Mashaba.
healthy.
Thank you so very much, Dr. Mashaba. Let's move on to our next guest, Peter Ucko, who's the CEO at Tobacco, Alcohol and Gambling Advisory, Advocacy and Action Group TAG. Thank you very much for joining us, Peter.
My pleasure. Good morning.
Good morning. So you at TAG are obviously inundated with calls and requests to assist those who are currently abusing substances, but this period must be one that is more difficult for you at TAG.
Substance abuse doesn't go away at any time of the year. That's the sad reality. At Christmas, I think we get a few more, at the holiday period, we get a few more reports, because the media starts to look for other things when they're not happening. So industry, commerce, all those things tend to shut down. Even world events take a little bit of a back seat, and substance abuse and traffic accidents become the main focus. But we have to focus on this the entire year. It's not only now. And one thing that many people lose sight of, and I agree, by the way, with Dr. Mashaba, who said that rehabilitation is very important. But I think there's a key that happens before we even get to the rehabilitation stage, and that's prevention. I think the major focus has to be on prevention. If you stop people from ever taking drugs, you don't need treatment centers, you don't need rehabilitation. And we've got a great shortage of treatment centers. People who've been sent, abusers and users, who've been sent, for example, to treatment centers by an order of court, very often can't get in because the treatment centers are full. But the key is starting at the beginning and prevention.
How do we prevent? How do we prevent when we have a society that entices people into taking substances, especially those that are legally available, the alcohol, the cigarettes?
Well, the first thing is to recognize that substances like alcohol and tobacco, nicotine, are legal addictive drugs. We tend to focus when we talk about drugs and drug abuse on the illegal ones like heroin and cocaine and others. But tobacco and alcohol are the legal drugs, and alcohol and nicotine addiction is the driver to all other drugs. If you go to treatment centers and you look at alcoholics, for example, who have been treated, probably 100% of them smoke cigarettes. If you go to drug treatment centers and you find people who have been treated for abuse of heroin and all the other illegal drugs, you'll find that probably 95% of them smoke. I don't have accurate statistics on it. But if you speak to managers at treatment centers, even during treatments, they stop for a break during lectures and treatments, and they go outside and they smoke cigarettes. So that's the key to stop. And the legislation, which has been crippled for the last 8 years, to go through to raise the age, not only of drinking, selling alcohol to 21, but tobacco products as well. We need to raise that to the age of 21. We need to introduce the program of what we call the end game in tobacco, so that we have a cessation of tobacco manufacturing, sales, use in its entirety in maybe the next decade. Certain countries and states in America and countries in the European Union are going that route.
So definitely we need to start re-looking at what we need to do to ensure that we prevent people from even taking substances, even those that are legal. Thank you very much for joining us, Peter.
Yes, what we need to encourage government, Patricia, please, is to pass the tobacco amendment bill, the tobacco control amendment bill, and the alcohol bill. Not only the one that's going through the Department of Trade and Industry, but the one that should be coming out of the Department of Health to raise the ages and things that Dr. Mashaba said of drinking. There's a lot we can do, but it starts with the legislation, and then it starts with the will of the legislators and the government. I don't see that will anymore, certainly not in the Department of Social Development, which runs the Central Drug Authority. There's not been one peep out of them in the last 10 months.
Sure.
So that's where we need the will.
Definitely the will. Thank you very much, Peter, for weighing in on our conversation. Let's quickly go and get a traffic update with Rob Byrne, and then we'll come back with another guest on the Mediated conversation, Daniel.
SAfm 104 to 107 nationwide. Leading the conversation. Conversations that you connect with and react to. SAfm.
Well, we continue with our mediated conversation, talking substance abuse during the festive season. Let's hear from you what your views are by you calling in on 011-714-2006, or you can WhatsApp 0614-104-107. SMSs go to 41391. Our next guest is Daniel Den Hollander, who's a clinical psychologist and empowerment agent for change. Daniel, thank you very much for joining us.
Thank you so much for inviting me, and I'm very excited to be on the show.
Daniel, from the two previous guests, it seems that we have recognized that substance abuse is something that's prevalent in our country, and according to Peter Ucko, it's something we should be campaigning against throughout the whole year, not only in the festive season, but also there are some interventions we need to implement, according to our previous guests, that it's better to prevent anyone taking substances. What's your stance? And what have you been seeing as a clinical psychologist around substance abuse?
Well, just to give you some indication of the stress levels or the prevalency levels, shall I rather say, of addiction in South Africa. According to the South African Stress and Health Study Survey, 5.8% of all South Africans suffer from substance abuse. We're talking about probably around the vicinity of 3 to 5 million South Africans who are at that dependency level. And according to the National Mental Health Framework, South Africa has the second highest incidence of alcohol abuse in the world. And we also know that the Western Cape and the Northern Cape have the highest fetal alcohol spectrum disorder rates in the world. To just give a substance to what was said previously, the Northern Cape specifically only has one addiction center, even though it has the largest fetal alcohol syndrome disorder rate in the world. And that just shows you where the neglect is in regards to care and access to care for South Africans. I think if we're talking about addiction, Look, addiction is a complex condition, which is an uncontrolled use of a substance despite harmful consequences. And individuals in active addiction have an intense focus on using a certain substance or cocktail of substances to the point where the person's ability to function in day-to-day life becomes impaired. And that results in them developing distorted thinking and behaviors, changes to judgment, decision-making, learning, memory, and behavioral control. And as a result of that, the person's life completely becomes obsessed around the addiction. We generally talk about 3 levels. We talk about usage, which is what we generally all do, which is the socially acceptable usage of any substance. Of course, we don't talk about illicit substances there. Then we talk about abuse, which is binge using, which is using any substance for the purpose of either altering your state of mind or altering the environment around you. And then we talk about dependency, and dependency is when my body actually craves or needs the substance in order to function. And usually around abuse, that can be sometimes handled on an outpatient basis with an addiction specialist. But when it comes to dependency, then the person actually needs to be in rehabilitative care. And that's where a lot of the problems comes in, is that rehabilitation in South Africa is like the Ritz Hotel in London. The doors are open to everyone if you can afford the rooms. And that's a terrible situation for a country where the high majority of the individuals don't have access to medical aid and therefore cannot afford to be able to pay for the rooms that are available in addiction centers around the country. Like as I said, just to give you an indication, Western Cape has got 35 facilities for a population of 6.8 million. Gauteng has 14 facilities for a population of 15.1. But Northwest has 1 facility for a population of 4 million. In Northern Cape, the 1 facility with the largest FASD rate. So it's a complete inadequacy in regards to facilities with the populations that desperately need the help. And I think as a result of that, that's why people don't get the help they need. When you get half the care that you need, you're much more prone to relapse. You're much more prone to being in hospital for other reasons, because remember that the body isn't designed to be able to deal with these substance addictions. And as a result of that, I wouldn't be surprised if we suddenly stopped addiction, that our hospitals would be probably about 30 or 40% less full.
Now, Daniel,
and that's the reality of the situation.
Daniel, for a person who has a family member who's abusing a substance, whether it's a legal substance or an illicit one, how do I, during this festive season, because it's a time where most of us are all together under one roof as a family, how do I handle the substance abuser? How do I assist them? How do I nudge them in the right direction?
So one of the biggest dangers with families is that we often enable the addiction. Because addiction, often we want to keep it under wraps. We don't want people to know that we've got a family member who's addicted. And so often what happens as a result of that is we try to keep it secret. And we do something what we call in psychology codependency, which means that we have an interest to keep it quiet. But unfortunately, because of the shame that's involved, and often shame comes from stigmatization, and stigmatization comes from community who's more interested in looking good amongst each other, keeping up with the Joneses, than actual care and love and appreciation that is necessary for a community to thrive. So often in families of addicts, there's conflicts, trust erodes, communication becomes more difficult, which highlights frustration. And the most important thing is to break the silence, to talk about the addiction and talk about the fact that the addiction is not acceptable in your household. And what's one of the most difficult parts of addiction is sometimes we have to differentiate between the individual and the individual and active addiction. And sometimes it does require a bit of tough love in the sense of, I accept you as a human being, but I cannot accept you as a human being in active addiction and you have a responsibility in order to seek that care out. And then it's about getting yourself to a rehabilitation center or to a psychologist who specializes with or focuses on addiction work and getting the care that you need to do. And that becomes a personal decision, a personal responsibility. So every individual who is an addict needs to take the responsibility to make that first step towards care. But it also requires for the families to be supportive to recovery. It's not like, how would you say it, that once you go into recovery now, you come out and you'll never be an addict again. In fact, we would say that even after having been recovered, we would still call ourselves an addict because of the understanding that the addiction doesn't go away. It's just that we have to manage it every single day. And that's the important part there, is the support and the love to say, we will support you into a life of recovery, but we're not going to support you into a life of active addiction.
Sure, there's a lot that we need to do as family members and as a society. And I'd really love to thank you for joining us, Daniel, and sharing the statistics. We now have an understanding where we are, but we also know what to do to assist those in our families who are actually abusing substances. Have a great festive season, and Merry Christmas to you.
Thank you, and a Merry Christmas to you and the listeners too.
Excellent. It's been such a great pleasure having this Wednesday edition of Sunrise. It's a minute before 9 o'clock. I think it's KG who's coming in to do Talking Point. Yes, the beautiful KG will be joining you from 9 until 12. And we'll be back again tomorrow morning doing Sunrise. But you know me, at 10 p.m. I come in for late night conversations. Thanks to the team. It's been awesome working with them. From my side, may goodness and grace lead you to the great heights of success.